Every year, millions of people experience allergic reactions. For most people, the reaction results in pain, swelling, or blocked sinuses. However, for some individuals, the reaction can be very severe. In extreme cases, a person may experience anaphylaxis, which can be life-threatening. This video is intended for those who suffer from extreme reactions and need to know what to do if they are stung by an insect they are allergic to, consume food or medicine that triggers an allergic reaction, or experience anaphylaxis in some other way. This video will provide a comprehensive guide on how to properly administer the QuickShot epinephrine injection contained within the kits provided with this video. If you are watching this video, it means that you have recently purchased one of these two kits. For this video, I'm going to be using this kit. Although both kits contain exactly the same things, they are just packaged differently. So inside of your kit, you will have your syringe and needle inside a packet. You will have your instruction manual, and you will have your very small little vial of epinephrine. So inside of your instruction manual, you have the usual customary introduction and warnings, and the really important part is the step-by-step. So your first step is to identify that you or the person that you think is suffering an anaphylactic reaction is actually suffering an anaphylactic reaction. All the symptoms that you need to look for are mentioned here, so it is often worth looking at the instructions before you actually are undergoing an anaphylactic reaction. Your second step is to fill your syringe with epinephrine. So what you have to do is you just take your syringe, open it through here, take it out, and as you can see it's already got the needle on the end. Okay, then what you have to do from here is you have to take the little cap off the needle, just place it to one side. Be careful now, the needle is very sharp. Okay, then what you have to do is you put it to the side there, and you must take your little vial of epinephrine. You must hold it so that the small thin part faces skywards. You have to flick the top a little bit so that all the epinephrine moves down from the top to the bottom. Okay. And then you have to hold it so that there's a little blue dot. You can see there's a little blue dot faces towards you, like this. Then you want to put your thumb and your thumb on the blue dot, your finger behind the blue dot, and to break it you want to push forward. Okay, so if the blue dot's this side, you would push like this. So, okay. And you can see it's a pretty clean break between the top and the bottom. And what you have to do is to make sure you don't spill, you put it on a flat surface and hold there. You'll take your syringe and hold it like a pencil and just put it in there. Okay, and then in the same hand you want to try suck up a bit. Okay, done. Then you just want to check that you have a decent amount. I need a bit more. Okay, so I'll come back to it. So now I have to hold the needle facing upwards to get rid of any air bubbles. So I'll flick here so that all the air rises to the top. And I push out like this until I have the correct amount in. Okay, the correct amount is 0.3 milligrams for people who weigh over 25 kilograms and 0.15 milligrams for people who weigh under 25 kilograms. Okay, then what you have to do is place it off to the side. I would recommend putting your needle cap that you still have here under there just to keep it elevated so that nothing falls out. Okay, and then you have to sanitize the area that you are going to be injecting. The area has to be the outside of your thigh. So you would take your outer thigh here and you would splash it with sanitary alcohol or water around there. You'd wipe it for a bit. And then you do the scary bit. You must take your needle and you want to put it there. I'm not actually going to inject myself for this demonstration video, but you would actually inject yourself and you'd push the needle in all the way up to the base of the needle. Okay, and then what you have to do is hold it there and push the plunger forward like this till it's all out. There, okay. And then you'd want to hold it here for about 3 or 4 seconds and just to let it sink in, and you'll pull it out very slowly. Just lay it off to the side. Then you have to rub the area you injected again for about 5 seconds, and then what you have to do is, this is still very important, you have to find medical attention as soon as possible. You also then have to monitor yourself for about 30 minutes. And if your symptoms still haven't gone away, you'll have to repeat the whole process again. Very importantly though, as I've already mentioned, is to seek medical care. Go to any hospital or clinic, they'll all know what to do. And yeah, and then you just have to dispose of your needle and syringe very carefully to make sure nobody else can get cut on it, and they might get some disease, they may not. So you just have to dispose of it very carefully. You can't just throw it into regular rubbish. Just try to be responsible with how you dispose of it. And then good luck guys, be safe, good luck.